A very good afternoon and welcome to another important session today. We are glad to have Dr. Githika Vakati with us today from Apollo Cradle and Children's Hospital, Kondapur. The topic for today's session is breast cancer, and I would request all our viewers to pay attention to the topic as our doctor will be sharing some great information, very important insights, and knowledge about the same. Also, if you have any doubts, any queries, post that on the comment section so that our doctor can take up all your comments and answer them by the last of the session. So stay tuned till the last. Don't miss out such important topics, guys. So I just want our doctor to take the session forward. Doctor, you have the stage.
Thank you. So, today I'll be talking about breast cancer. Breast cancer is the most common cancer in India and all over the world. Uh, and when breast cancer is detected at an early stage, the chances of its uh, treatment and the breast cancer getting cured is very high. The treatment options and the management of breast cancer has improved over past 10 years. That the patient who is diagnosed with breast cancer, the survival has improved from 75% 10 years back to 90% now. So we'll go on to the risk factors of breast cancer. There are The risk factors can be categorized into two groups: non-modifiable risk factors and modifiable risk factors. Non-modifiable risk factors include age, which as the age advances, the chances of a patient getting a breast cancer will increase. And another non-modifiable risk factor is the female gender, which nothing can be done about. A female will have an increased risk of breast cancer when compared to male. At least 1 in 8 women are prone to develop breast cancer, whereas in males, it's 1 in 1,000 males getting breast cancer. The other risk factors which are non-modifiable are genetics and or a family history of breast cancer. So any relatives, first degree relatives, second degree relatives diagnosed with breast cancer, so the risk of the children getting the breast cancer will indefinitely be high. The other risk factors include a certain race which is prone to develop breast cancer. The other risk factors, which are modifiable risk factors, are obesity. High obesity, high BMI is associated with an increased risk factor. Um, and patients who are nulliparous, that is females who don't have any kids or who didn't give birth to any children, are at increased risk of breast cancer because of the increased level of hormonal exposure in those women. So pregnancy acts as a protective uh, factor in breast cancer. Similarly, a mother who has fed her child for more than 6 months, that is lactation, also acts as a protective factor from breast cancer. The other modifiable risk factors are alcohol consumption. When consumed more, also increases the risk for breast cancer. Smoking also increases the risk for cancer. So all these modifiable risk factors can be any changes in the lifestyle modification can decrease the chances of risk factor of getting breast cancer. So, screening in breast cancer is when the patient who doesn't have any symptoms or any complaints or any lump in the breast will be screened using a mammogram on an ultrasound, so that we can detect the breast cancer at a very early stage. So, screening is done in patients who are asymptomatic and do not have any symptoms related to breast in them. Cancer screening is usually done starting from the age of 45, and it will be done till the patient is 75 years old. Uh, the screening of breast cancer starting from the age of 45 will be done once in a year with a mammogram, and it will be carried on till 75 years of age. Uh, the symptoms and signs and symptoms of breast cancer are: the most common symptom of breast cancer is a painless lump in the breast. Most of the patients come to us saying, we didn't have any pain, so we did not consult any doctor, or we did not feel it was necessary. But pain in breast cancer means that it has advanced to the last stages of cancer. Initial stage, the lump in the breast will be painless. There will be no pain. There will only be a lump in the breast, which is painless. There might be some discharge, some watery discharge or a blood stain discharge. And there may be sometimes lumps in the axilla or in the armpit. But the pain in lump in the breast is does not indicate that there it is breast cancer. The other signs are the other signs of breast cancer are any discharge, blood stain discharge, or any changes in the nipple, or from what it was looking before to what it looks now, or any lumps that can be felt in the armpit. So once, if there's any suspicion or doubts of of any lumps in the breast, what do we do next? We will go about with an imaging, which can either be an ultrasound or a mammogram, depending on the age of the patient. If it's a younger age group patients, we would generally prefer to do an ultrasound. But if it's an old lady, more than 45 years of age, it is definitely an mammogram which has to be done. Along with the following imaging with ultrasound or mammogram, we will need a biopsy, which is generally the most commonly done is the true cut biopsy, which could give a diagnosis of what kind of a lump it is. Imaging will tell us, um, that is ultrasound or mammogram, which will just tell us if the lump is there, what kind of a lump is it. Is it a solid lump, or is it a lump which is filled with water? That's it. But what kind of a lump it is, if it's a benign lump, or is it a malignant lump, or is it an cancer lump, will only be confirmed only once the biopsy is done. After the biopsy, biopsy will be confirmed, will confirm the presence of cancer, and there will be various other tests that would be required to know which type of breast cancer is it, because there will be many varieties, many types of breast cancer, and the further treatment depends on what stage the breast cancer is, what type of breast cancer it is. So, once we have been diagnosed with breast cancer, if it's an early stage breast cancer, there will be certain more investigations that will be required to done, if to see if the cancer has spread to any different organs, which would be a scanning of an abdomen, a chest X-ray, an ultrasound of the armpit or the axilla, and if it is a more advanced stage, like stage 3 or stage 4 of breast cancer, you may even require a PET CT. So once it is diagnosed with breast cancer and you have been staged into four different stages of breast cancer, and once the type of breast cancer is known, your treatment will vary. Each type of breast cancer, there are different options. So, the available options for breast cancer are: first is surgery, next is chemotherapy, wherein injections or medicines are given via uh, through injections which target the cancer cells. The third option is radiation therapy, wherein a current is given which will deal with the cancer cells. Fourth is hormonal therapy, wherein some medicines are given to take care of the cancer cells. Another one is targeted therapy. So, which therapy to be given depends on the stage of cancer and type of breast cancer. Early stage, like stage 1 and stage 2 breast cancer, most commonly preferred treatment is surgery, followed by, based on the biopsy report, we would like to decide whether the patient requires a chemotherapy or a radiotherapy, and a hormone therapy or targeted therapy, depending on what type of breast cancer the patient is having. And if the patient is diagnosed with a stage 3 cancer, the first treatment choice would be chemotherapy. So, first, why we give chemotherapy is when chemotherapy is given, the size of the lump, which is the cancer lump, it tends to decrease in size with chemotherapy. So, once the size is decreased, the surgery becomes easy. The survival, though it is same when given after or later, but the patient who was initially a candidate for total mastectomy, that is a removal of the entire breast after giving chemotherapy, may be a candidate for a breast conservation surgery. But after neoadjuvant chemotherapy, once all the chemotherapy is completed, they will eventually require surgery. After that, depending on the type, radiation therapy, hormonal therapy, or target therapy. One, and when patient is diagnosed in stage 4 usually means that the cancer has spread to different organs other than the organ from which it has origin. And in stage 4 breast cancer, the treatment is chemotherapy. So, when we talk about surgery in breast cancer, there are many different options available for breast cancer surgery. So, earlier it was only mastectomy, where the entire breast will be removed along with some nodes or lymph nodes which are found to be suspicious on the in the axilla. But now we have progressed from total mastectomy and lymph node dissection to breast conservation surgery, wherein in breast conservation surgery, the lump, that is the cancer lump, along with a margin of a normal breast tissue, will be removed. And then only if there are any suspicious nodes or any lymph nodes are there, that will also be taken care of during the surgery. But there will be the size of the breast will be a little less compared to the non-operated one. Chemotherapy, following this, the patient would receive the other management treatment options that are required. So, the diagnosis of breast cancer in early stage is very important, because patients who are diagnosed with breast cancer at an early stage, the survival is much better. That is nearly 90 to 95%. They have more treatment options and less aggressive treatment options. So screening will help in detection of breast cancer much earlier. So it is very important, because the patients who are diagnosed with a later stage breast cancer, they need more aggressive treatment, more aggressive surgery. The patient has to it is more aggressive treatment. So it is very early, it is very necessary that patients are, they are aware of their breast, and they even when they notice any small changes or any small lumps or any small discharge which was not there previously, as they have noticed it now, it is better to get it evaluated, especially in old age. Breast cancer can also be there, can also be developed during pregnancy or during lactation. So we have to be very much aware of any lumps which are not subsiding, which are not decreasing. And also breast cancer, uh, old age is the risk factor for breast cancer, but it can also occur in patients between 30 to 40 years of age. Recently there has been increased trend in the patients developing breast cancer, and we have seen more and more younger patients developing breast cancer. And when breast cancer is detected in younger group, it is more aggressive kind of breast cancer. So it is very important that any lump, any suspicious lump which was not there previously or which is rapidly increasing in size should be evaluated for breast cancer. So screening plays a very significant role in detection of early breast cancer.